Hello, everybody, and welcome to this week's edition of the AHA podcast. Hello, hello.
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 So, Melissa, hot off
Yeah.
the heels of the Humana rollout in DC, highlight for me, of course, was being at the Watergate Hotel and having a Richard Nixon tour, tricky
Yes.
dick, as they say. I'm
Yes.
not a crook. And seeing the Watergate room. So that was sort of fun. Nothing to do with the podcast today other than a good job to Humana for the entertainment value. And I didn't even know Watergate was a hotel and that it was in DC and that they are keeping it alive. But
Yeah.
setting that aside, let's talk about some of the highlights and, what was the theme that you saw overall? And then Jennifer, you can kind of add in there too.
Yeah. It's funny that you said hot off the heels because we were just talking about how hot it is in DC. Like we live in Florida, but DC is like hotter than Florida. It's crazy. So it was very hot. And the Watergate was amazing. But so the theme that I took away was making it easier to work with Humana. So they want to make it easier for agents to do business with them. They want to make it easier for beneficiaries to work with them and find a plan. Overall, I think they didn't dive too far into the benefits for 2027, although I did do a little video this morning that I think is out on our socials about, the outlook. We know there's going to be some plan exits for 2027, as they alluded to, about 600,000 impacted members. Most of them.
Some. You're the queen of understatement.
Yeah.
Some
Impacted.
600,000 plus 40% of the remaining 3.5 million. But other than that,
Yeah, definitely some impacts. Florida is the top place where we'll see those impacts, and Texas and Georgia were the other two states. I guess if there is a good news to that, on the flip side, is that in most of those markets where the plans are exiting, there will be a comparable Humana plan. And so they did talk about when the first looks come out later this month, they are also with that releasing a guide for agents that will show, hey, this is the plan that's exiting, but this is the comparable Humana plan that you could move the person to, because they are worried about preserving the benefits that members value the most. The plans that I think you're going to see exiting, of course, are the ones that were non-commissionable in 2026. So as we expected, those plans will be exiting those markets. So more to come, but that's kind of what I took away the most. And of course, just star ratings and quality. That was repeated like so much throughout the event.
yeah, maybe did you hear about crosswalking the plans for the Care Plus or no?
I did not. I don't have any information on the crosswalks. They didn't really talk too much about Care Plus really at all during the meeting. So I guess that remains to be seen.
Sidebars. I'm pretty
Yeah.
sure they're planning on doing that. Jennifer, what were your takeaways? What theme did you see? Alyssa had some good tactical stuff there for us.
Yeah, definitely making things easier. Simplicity, so stability, which we've heard from other large carriers, was a key point that was taken away. Last year, I believe they introduced in several states sort of a simplified plan portfolio, and they're planning on continuing that again this year, coming into 2027. So we're seeing where there's just like, it's sort of like a wave. There used to be like more of a simplified portfolio than they were having like a whole bunch of different kinds of plans. Each county would have their own plans. Now they're kind of making things more simplified again. So we'll see that. It's interesting because you mentioned they did talk about this in the earnings call. They also talked about it at the meeting about the 600,000 plan exits, and they think they'll recapture a good portion of those members. They also said that's only like 8% of the market. Big takeaway there is just to help agents get prepared, especially in states like Florida, where there may have been plans that were non-commissionable. That might be writing on the wall, getting those agents ready with those books of business. And we can, I would recommend like an ANOC or maybe doing some in-person seminars to meet with your clients.
Mm-hmm.
And then they got some new leadership too. That was a big theme. They introduced their new leader that they brought in. So overall, it was very high level, but very positive meetings.
Yeah. What was the new leader's name?
Mark
Tino.
Tina.
Yeah.
It was
His
sharp.
the second
I
day.
liked him.
Yeah. His literally second day on the job, which is
Yeah,
crazy.
he led external distribution for Verizon. I'm surprised that you and Alyssa, in my opinion, you guys are burying the headline. To me, the headline was quality. And they had quality plastered everywhere on every slide. And they talked about it. They talked about the importance of it. And they did have, simplicity and making it easier for the agent. Everything you said was true. But to me, the headline was quality. And, they've changed the way that they're going to pay a little bit going forward, to focus on the quality and to kind of spreadsheet us like you're back in school. They had their own metrics though, so they really put a lot on the rapid disenrollment rate. I think was probably the heaviest hitter there. They really want you to get that information, for the health risk assessment kind of data plus, which makes sense, if you're on the phone and if you're in person and you've done a good needs analysis, or if you're on the phone and you've done a good needs analysis, it's not that much more, a couple of minutes, I think, to get any additional data. And then that should be available on the Humana website too, to capture there. So I thought that was good. I've talked many times about quality and the importance of quality. Now we're at a point though where people aren't measuring quality the same way, which is okay because it's a big step forward. But to me, it's, the accretion rate matters because a lot of people that submit, with maybe some random code or they just see what sticks, that still consumes a lot of resources and sets people's expectations, I think, inappropriately. But accretion, rapid disenrollment, they didn't put annual retention as a metric out there, although that'll come up later. And their financial, leader, he talked about the 5-year retention rate. We talk a lot about the 1 year, but they definitely talked about that. They didn't mention complaints to the health plan at all, which I thought was surprising. I think that that's a key one that we should have visible. And then they did talk about complaints to Medicare, which I think you could change the definition of what qualifies as, a complaint, quote unquote, to Medicare, but definitely taking that very serious. And to me, I was most proud, or I guess most happy to hear that they're going to have one standard out there, and that they're going to set a quality metric and baseline it. And I think that is very important. And then Jacqueline, you were kind of holding down the fort this time. Anything happening on the home front, client care team, insights, and any secondhand information you heard from the Humana meeting, not being in DC, but always hearing all the scuttlebutt.
Yeah, absolutely. I felt like I was there with all of Alyssa's awesome content. I felt like I was almost there. So thanks, Alyssa, for sharing that live.
I like the one with the monument
team.
and the Potomac
Me
in the
too.
background, the
That
little
was
mini.
awesome.
That was my favorite one.
Yes, we found our own Washington monument, which was cool.
Yeah, absolutely. I would say, a lot of our agents right now, especially the ones working on the client care team with big bucks, the priority is just getting ahead of ANOC and AEP. So right now we're getting a big wave of requests for those support inquiries, and agents are scrubbing their mailing lists, their communications. So now is really, like, I would say, near peak time where agents should really be involved in that planning, and we're here to help you too. Also, it's an interesting time because when ANOCs come out, which are expected by the end of September, members that if their plan is not going to renew for next year, they'll get a termination notice too. So I think agents are just trying to get ahead of making sure that they comfort their clients, that those clients can reach back to their agent, and that they know they have a good resource to help them navigate through this time, whether there's a lot of changes or not too. So we're just actively working on those kinds of things. And we've been finishing up some onboardings of our agents as well, and working a lot of client cases. So it's been a mix. Our last podcast, just to circle back on, gained a lot of traction from agents. It was a why not to sell your business. So I've heard some good feedback from agents thinking I never really thought about it like that before, or maybe I should really start thinking about my plan. So I've had a few conversations with agents. So it's out there. I recommend watching that too. And this is the time to really lock in, they say, for the season. So just as another reminder, don't let your fears run away with you. I think there's something in the air during this time of year where you feel, a little bit nervous. You want to be prepared, and you can kind of feel something coming. So just, I would say, do things that keep you level headed. I think we all are, and it just helps everybody, and we're a team. So we got your back.
And I'm glad you said that. And that segues me back to Humana. And I think I'm going to go over some of the topics and let you all, fill in some of the blanks. So Jacqueline, the one thing that Humana did many things they did a good job on. One thing that pertinent to your comment is the growth of the market, right? And so there's a financial component I'll talk about in a minute, but just generally, demographics, sometimes people say demographics are destiny. So it's 8.5%, 8% growth, the Medicare Advantage population. What that means is that we're going to add millions and millions more, right, between now and 2030. They expect 2030 to hold 62% of the population to be Medicare Advantage. It was also cool that Humana is having a birthday as a company and they're going to be
Yeah.
turning 65. I thought that was cool. I asked if I could be their agent, but they seem to be okay there. And so, I think that's really telling, right? What industry grows, organically at 8.5%. So that's good. So if you grow faster than average, you're going to be at 10 or 15%, but just status quo is going to get you 8. And a bigger percentage it's already past 50%. Now we're talking about moving into the 60s. And guess what? They didn't talk about this, but after 2030, it's still the beneficiaries go from 80 million, of which 60 plus percent, 62% projected. But then it's going to go to 100 million in 2050. And who knows, 75%, 80%. Puerto Rico is like 80% now. So, I mean, I think that the market, if you talk to the leaders in the various organizations, like at CMS, they want everybody in an MA plan or in an ACO. Now, the opponents to MA, they're not really opposed to MA as a matter of principle because they know that people like it. They know that people get better care, and their fears more align around two things. They're worried about the fraud or people abusing the system, upcoding and just behaving badly. Or there's too many benefits, right? We're not getting the value. I think most people that I've talked to, like at MedPAC and other places, the former MedPAC leader, they agree. Vision, hearing, and dental is great. Oral health is very clearly connected now to your overall health. I think they're seeing, long term versus short term, but there's still the jury's out on, chiropractic, maybe definitely acupuncture they felt was too far. Some people were like, I don't know about the gym membership or health plan. Now there's cases to be made for lonely people. And, if people that go to Silver Sneakers, they're going for the fellowship as much as anything in a lot of cases when they live alone. But, whatever they sort through on the benefit structure or the transparency to utilize the benefit structure, we are a national infrastructure, a shared infrastructure. FMOs, we haven't got a raise in like 10 years. Agents, God bless you. You get a little bit of uplift every year thanks to CMS. We don't get paid on things we used to get paid on, not to complain or whine, but we're a terrific value. So I put that out there just because we've been getting the same paycheck for 10 years. We get paid on fewer things like PDPs, but we still keep making it happen. And that's a tremendous value and safety net for regular beneficiaries. So that's towards your comment. And then the other thing I'd say, Jennifer and Alyssa, I thought that the plan value structure they announced was really good. To me, the 5 different kind of archetypes of consumers, someone who wants the all-in plan, someone who wants the stream down plan. Tell me what you saw on those. I think it was 5 different ones, Alyssa, and what you think.
Yeah. So I think it helps simplify for agents and for beneficiaries, not to put somebody in a bucket like that, but it does give them a better starting point for what needs might be for particular beneficiaries and then kind of what benefits that person might be looking for. So, and I think I've seen that in some of the certifications too, where they give examples of, hey, beneficiary Mike is active, sees his primary care doctor, or you have somebody who's a higher utilizer with higher needs and a chronic condition. So I thought that was great. And, the thing that Humana mentioned a lot too was, making sustainable benefits, things that are going to prevent disruption down the road. That's going to keep, they talked about lifetime. They want a member for life. So they want to make the benefits sustainable, not rock the boat. And they also use the term the right way to win, which I think is really important because when you say the right way, obviously that goes into compliance and making your plans better. And it's just the right way to do things. And for agents too, we always talk about that, doing the right thing at the right time for the right reasons.
Yeah, I thought it was fantastic. And think about it. It makes sense that, and I'll get to you in a second, Jen. The logic is perfect, right? Why wouldn't you segment the market? Why? I mean, shoes come in what, like 17 different sizes. You know what? Shoes in small, medium, and large, right? A good fit matters. I mean, people want choice, and that's what the law says. You should get to choose a plan that best meets your needs. And so, thinking about someone who wants the full bundle versus a streamlined bundle. I mean, what if you're on Medicare and Medicaid, right? You've got different needs. What if you're a veteran and the VA is the primary? Well, you still are entitled to Medicare because you earn both sets. You earned your veterans benefits and you earn your Medicare benefits. And so you deserve both of those. But what if you are more heavily user and you have a great, VA facility near you and they understand you, but you want to round that out a little bit, with some of the MA plans, then you don't need the more robust plan. So I think that's, spot on. And that's an industry trend that I think will continue. How about you, Jen? You pick up anything on that benefit structure or the archetypes I'm using the word archetypes. That's not the word they use. So say a segmented market, different benefit structures.
Yeah, I think that they're probably saying that what they did last year in a few of their states was successful and seemed to work well. So they're going to try that in other places, and hopefully that keeps things more stable with people on plans. Overall, there is a very similar message here that we got from a lot of the other large carriers. This will be in hopefully a final year of the mass disruption, coming out of the whole Inflation Reduction Act and the cost pressures that the carriers have. I mean, I'm optimistic that this is the last time we'll see this, but if you're an agent listening to this and you're in a market where you have disruption, I just want you to know that you can do this. It seems scary, but your members need you. Get them on the right plan. These carriers have really done a great job trying to create a plan that they feel good about, that they can keep in the market and that members will be able to stay on, right? And I don't know that we'll have quite as much disruption in the future, but there will be some this year in different markets, and your uplines are here to help make it perfect for you as much as it can be. I'm curious to see how that will work. Again, we know that they mentioned disruption a lot for Florida, Georgia, and Texas, although there'll be more disruption. So we're prepared to try to help agents in those states as best we can, and they are too. So, but you're right. We buried the quality under the quality thing, and that was a really big topic.
Yeah. You gotta be careful not to bury the headline. But to your point, Jennifer, not just on quality, but in the changes. I mean, this will be transformative. I mean, this 40%, more than 40% of the industry is going to need to change. I think everybody should really evaluate their options, and that takes needs analysis. I do think this is sort of the epicenter of all the years. So this will be the big one. It won't be perfect next year, but the financials also, Humana showed a really interesting slide on the industry financials. And so, last year and this year, or the last 2 years, were a loss, right? So now some companies won and some companies lost individually. But as an industry, when you average it all out, the companies lost money. And, and that's the pendulum swinging too far the other way, right? They made cuts under last administration. They made cuts under this administration. They have IRA drug coverage and, financing of drugs and all these things, that are mandatory. The other shoes, dropping, now and a little more later. But that is kind of the way that it goes, right? These things move too far one way and too far the other. So the profit as an industry is driven out, and they're losing, 1%, 0.5%. And this year they've got a 5%, in 2026, 5% kind of to the good. And they were negative last year and the year before. And so they think that that'll go down to 2.5%. So not as bad as it was and not as good as it is, but 2026 from the plus 5% is actually pretty good. So that's nice. And then I think that you're going to see the industry, like you said, Jennifer, stabilize, and they want to stabilize, but it's going to look a little more, as I say, like Swiss cheese, right? You're going to have spots where basically they're going to compete where they know they can win. And to do that, they're going to pull resources from other markets, which is why there was so much disruption this year and last year. And, there's rules around how fast they can take down the benefits. So they can't just, go to zero benefits. They've got to taper that. And there's some rules around how fast they can do those things. And so they're responsible to their shareholders, and rightfully so. And so they have to be able to do what they do profitably. So you're going to see some clear winners in some markets, and hopefully some other markets. I'll be going up to see United tonight or tomorrow. And, that's obviously going to be a meaningful discussion, but hopefully they'll all balance it out so that there's something for everybody in all the counties. And, that's all we can hope for.
Yeah, I want to add to what you said there, because overall, again, they're moving away from all the carriers together. Like a general theme is moving away from the really rich PPOs. There'll be some PPO options, but they're moving away from that in general, making the HMOs more attractive, through having those relationships with providers where they can control those costs and interworking. We're going to see introduction of C-SNP plans with a lot of carriers, and then to try to capture some membership that will be lost from D-SNP changes. The reason we're seeing a lot of D-SNP changes is because of that, the SSBCI, but also the integration with the states. And there's some places where we've learned where a carrier is only allowed to introduce so many plans with D-SNP in a particular market. So we're going to see a lot of C-SNP entering, and that might be able to be a nice place where membership can go. I just find it really interesting. Oh, and the last thing I'll say there is the Part B givebacks. You're going to see a reduction in those. It's not that there won't be any give back plans, but they may be more on an HMO chassis as opposed to a PPO chassis. And those amounts might be, reduced. Who knows? That's a trend we're seeing across all the carriers. Last thing too, I just want to mention is, you mentioned the Swiss cheese. I think what I've learned is like every carrier wants to win in the same places. And then the places that they don't want to be anymore, there's very few options. So that's definitely a challenge. I don't have a crystal ball on that, and I don't have any influence. But if I could speak to like CMS, I'd say, why not offer some incentives for these carriers to introduce more plan options in places where they're not wanting to be, like the Northeast or the Midwest or some places like that.
Well, we had this talk, and so I was chiding Jennifer a little bit because she said they should offer more incentives in those markets, and I said, well, why not take away incentives from the other markets? I was playing devil's advocate there. But, just a little interesting point here in our final few minutes. The original, kind of like in the 1980s, not that any of you were around then, but, I was. And what happened is, ironically, the commercial HMOs, they saw some management and some administrative efficiencies coming, and they wanted to capture that in the Medicare market. And obviously, this was, like pre-Medicare plus choice, right? There's been a private option for Medicare for a long time, prior to MA, Medicare plus choice, et cetera. But my point is that they were trying to, find those efficiencies. And as you know, in the 90s, they had the cost plus contracts that didn't go so well. So what had happened is the reimbursement rates for hospitals where they perhaps had sicker people, they based the current model off of the existing model. So Miami had a lot of sick people getting a lot of care, and so they spent more money, and so they get more money. And so everybody sort of looked at that model, and they look how they game the model, and they think about changing the model. But that's the model that we sort of inherited and have been living with. And whatever they do for quality bonus, it's always hard to measure things and to come up with good rating systems. But the idea that there's goal alignment, right, between the desired behavior and there's some control measures to stop people from behaving badly, I mean, that's inherently a good thing. And it's caused a lot of innovation. I mean, think about it. Medicare Advantage created vision, hearing, and dental in the same comp structure. So people are better off. It is great when private companies compete and they create, and it's very good. Occasionally they'll get out of hand. So you need some checks and balances in there. You need some oversight. Because you don't want the factory to pollute the water and poison the people that work at the factory. It's funny that would happen, or not funny, but it's shocking that would happen. But it does, and so you do need some adult supervision. But all in all, you don't want to stymie the innovation and stymie the new things that we have to work with. So we'll go kind of a lightning round here. Jacqueline, Jennifer, and Alyssa, any closing comments, insights, tips and tricks for the brokers out there listening?
Yeah, I think, for us, we're helping ANOC right now is a big priority. So please make sure you have your plans set in and established, especially before September 1st. A lot of things gets rolling, and time only seems like it moves faster in September. So now's the time. We have a couple of weeks left in August. It's a great window to really knock out your plans, get your mailing list together, look at our catalog, and have a game plan.
I'll just recap real quick for those agents on the quality topic. Where can we use your help? 4 things. 1, watch your rapid disenrollment rate, meaning do a proper needs analysis. That's going to be the most heavily weighted thing. that they're looking at. Number 2, please complete an HRA. We need your help. Number 3, watch the CTMs. We're pretty good there, but just, make sure you don't have any complaints. Again, that goes back to the proper needs analysis and setting expectations early. And then the fourth one would be choosing top preferred providers for Humana. They're really looking at people like that. It's weighted the lowest, but just looking at those hearts and badges out there when you're picking a particular provider to, that's in that network. That won't always be the case, but as much as you can help them, that helps as well.
Yeah, but that's a good point, Jennifer, because 75% of the country has a preferred provider. I mean, why wouldn't you want your person to go to a better performer, right? That's a no-brainer. Thanks, Jen. That was a great recap. Alyssa?
Yeah, I think, like I said, the biggest takeaway is that carriers are looking to be sustainable and stable for their beneficiaries. And I think for agents, the biggest takeaway is stay educated on the plans. Obviously, can't talk to your members about these 2027 benefits and everything until October 1st because they're still not finalized quite yet with CMS. So just be careful of that. But you can be reminding your book of business to pay attention to the mail that they're getting, make sure they look out for those ANOC letters. And obviously the top 5 lagging indicators of quality that we talk about is something that should be forefront in agents' minds too, doing a proper needs analysis so that the rapid disenrollment rates stay low, that the accretion rate stays high, that their retention is good, and the complaints stay down or hopefully down to 0. And I think for advocate, my takeaway here is you can never do too much training, right? Like I'm already thinking about how I'm going to work this into future Advocate Health University sessions, which plugging the one we have on the 18th, I'll see if our team can link that down here so you can register because on the 18th, we're doing one on compliance. But that's what I take away too, just keeping that at the forefront of everyone's minds.
Yeah. Thanks, Alyssa. Yeah, I'd agree with everything you all said. And I mean, there's no reason for anybody to ever call Medicare, right? If you're doing your job as a broker with us as an FMO, there's just no reason. The broker and the FMOs, the quality, which is most of us, it's our day. This is our time to shine. I've been waiting for this, quite frankly, for a long time and shocked that the industry was able to stay in that land grab mode for so long and tolerate, lower quality and still paying lower quality the same as high quality. And so it's great, the infrastructure we've built. This will reveal a lot. As Warren Buffett used to say, when the tide goes out, who's not wearing their swim trunks. We're gonna see where, as we start to measure, we're gonna see where the quality is coming from, and that translates directly to earnings per share. And that earnings per share, remember, that's not just greedy corporations. Earnings per share translates into the ability to put more revenue into the benefit structure and preferred, 5-star ratings, and it's a virtuous cycle. So I'm excited. And I agree most of all with the tactical things. This is the time to really know your book of business, to talk to your book of business, start building those spreadsheets. Because I'm telling you, some people don't spring into action on October 1st. At the stroke of midnight, you better be out there getting after it because you've got 15 days of pre-activity and you're going to need every minute of it because you're going to know who needs a change, undoubtedly, who you need to talk to, because don't forget, the plans change, but people's own needs also in their life situations change. Nothing says you can't talk to your people now and get an update on how they're doing, get an update on their, family, get an update on their, personal life, and just warm them up and, reconnect, right? Stay connected, but freshen that up. And that way, they know that you're going to be calling them again as soon as it's appropriate to do so. So with that, how time flies, already at 30 minutes and change. So thank you, everybody. Great work. And look forward to doing this again next week, talking about United.
Thank you. Bye.
Thanks, guys.